Dr. Nina Byrne talks to Maura about dealing with common Christmas ailments on today's 4 Live. But now we're in Shortland Street Clinic, where Brenda's stirring things up.
Your actions are personally based. They nowhere resemble those of a true professional.
As usual, it was too much to expect impartiality on your part.
That woman has screwed over nearly every physician in this place, you included.
All right. Maybe I should speak to her.
It was unfortunate that Chris had to leave so suddenly that he had no choice but to leave a man in your condition as a standard.
Okay, I have tried to discuss this with you in a civil and professional manner, but reasoning with you is impossible. You leave me no option but to issue you with an official warning.
And the Palliative team have revamped the intranet site. Take a squiz. And the memo is in-service training, blah, blah.
Ah, memo. Haven't had one of those in a while.
What was the last one about? Oh, that's right. Nurses shall do everything by the book.
And doctors shall not treat the nurses like crap.
Okay.
So what's the story, and are we still at war with the doctors or not?
Yes, the IV lines. Can we do them now?
And the verbal orders?
Yeah, I'm all a bit confused about that too.
Right. Well, sorry for not making it clear, but it's business as usual. Getting the best job done for the patient, whatever route that may be.
So did the doctors just decide to pull their heads in, or did you...
Sorry, Tans. Do you mind if we move on? I'll answer any other questions later. Sure. Right. Well, that's it, team. Jackie, do you mind if I grab you for a sec?
Isn't it nice to see our great leader so obliging and non-confrontational these days?
I know you know something.
See these lips? Sealed.
I can assure you that any pillow talk from Craig that is shared with me goes nowhere.
And I can assure you that the new look Brenda will be on her best behaviour for quite some time.
Well, hallelujah then.
I think you've given me the wrong diary.
No?
But there's stuff all in it. I mean, look at today's page. It's as white as the driven snow.
You're chairing an HOD meeting this afternoon.
Yeah, which isn't for another 5 hours.
Giving you all the time in the world to prepare.
Let me see that.
See what?
The great big file with "Attention Chris" written on it.
These are all things that Chris needs to deal with when he gets back, which, seeing as you won't tell me when that is...
It's a need-to-know basis for you and for me. Now, I don't think he'll appreciate coming home to a mountain of paperwork, so how about you let me share some of his pain?
As acting CEO, I can see why you'd offer to do that. But as personal assistant to the real CEO...
I can't sit in here all day signing cheques. Now, give me something to do, woman.
Busy?
No, thanks to Libby.
I'll have another whip through these and see if I can find something within your jurisdiction.
At you sitting there in all your glorious jurisdiction.
Is there something I can help you with? I mean it. Anything at all?
Well, you fixed Brenda for us. Turned her into Florence Brick and Nightingale.
Well, at least someone thinks I'm useful. If Libby had her way, I'd be sitting in here drinking tea all day and reading magazines.
Libby needs a raise.
I'm going to be so bored.
Good. Bored means you're resting. Bored means Alice happy.
Oh, is that uncomfortable?
Go ahead and talk to me all you like. I ain't gonna squeal.
All right, tough guy. I think your pain is due to urinary retention, which means that we're going
I
to...
need a catheter.
That's right. Now, are you in pain anywhere else?
I've had increasing abdominal and flank pain for the last 6 months. More recently, pins and needles. And I've got decreased sensation in my arms and legs.
Are you a medic?
No. I've got lung cancer. Non-small cell.
Right. When were you diagnosed?
A year ago.
I'll grab the trolley. Thank you.
Okay, so that's the bad news.
Now, who's your oncologist?
Oh, Dr. Lyons over at Central. Should be able to have a yak. Although if I were you, I wouldn't wait too long.
Oh, why's that?
Well, because first, I only have a few months to live. And second, because we're all about to be swept to our doom in a flood of urine.
Well, Mr. Davis.
Oh, call me Gary.
Gary, you get 10 out of 10 for attitude.
2 pieces of advice, ladies. Whatever you do, don't make me laugh when you put that thing in there. And when you do, stand well back.
And just what do you think you're doing?
My job.
Everything's running smoothly, isn't it? No one's complaining, nothing's out of order?
No.
Then you are doing your job and there is no reason to go through Chris's things.
Libby, I need some idea what's going on inside this damn hospital.
Which sounds absolutely fine in theory, but ignores the fact that only Chris understands the big picture.
I understand winter workload plan. Now that easily fits into my jurisdiction. Couldn't you just give that one to me? You'll remember that I did actually apply for the job of CEO.
Yes, and with the right CV and the best interview technique, you would have got it.
Other way out? Or I'm dyslexic. Problems? Oh, no, it's nothing.
Just stopped us writing in their own special language again.
Gavin Kappa, I should have known.
No, it's no biggie.
That one looks like 3 across.
I'm seeing immediate discharge.
And the wavy line, fishnets.
Finish medication? Give him a call, get him to clarify. Oh, and tell him there's only one C necessary.
Why did you poke me? I'm going to get a bruise.
I thought Brenda would use this as ammo against the doctors. Send out a memo about illegible handwriting, bring the hospital to a standstill.
Oh, she's over that. She said so this morning.
She said it, Maya, but does she mean it?
I think so. I hope so.
Hold still. Hey, tough guy. How's it hanging?
You know what's so good about being an end-stage cancer? Everyone you meet's a bloody comedian.
Now, has that catheter made any difference?
We just hit low tide in Bladder Bay.
Good. And your back pain?
I'd be lost without it.
Well, how about we give you some morphine and christen that cannula?
I accept your offer of morphine, and as soon as I'm done here, I'm going to raise you a hug.
We're all done.
Well, it's the first time I haven't felt a thing.
I have a good teacher.
Oh, get her in here. I'll sing your praises.
The good teacher also happens to be her boss, who also happens to be a bit of a dragon.
Oh, she doesn't have time to listen to compliments.
Our Brenda's a bit busy cleaning out her nostrils. All that fire and smoke.
We wouldn't be talking about Brenda Holloway, would we?
Do you know Brenda?
I do.
Oh, well, I can track her down for you if you like.
I'd prefer to remain incognito if you don't mind. It's just my family will be here any minute and they'll tie me out. And I'm not quite looking up to scratch for old friends, eh? So maybe not, eh?
Sure.
I don't understand this little note.
Winter workload plan. Add it to this afternoon's agenda, please.
Yes, I can read, but I don't understand why you'd add it to the agenda when Chris already has the winter workload plan in place.
Have you ever been a patient in the middle of winter?
No.
Have you ever run an emergency department in the middle of winter?
No, but...
Well, I have. So, if you don't mind, I'd like to have a little input here, in the absence of any other pressing issues.
Actually, there is one. Staff parking.
What about it?
Well, you must have heard the grumblings. There's not enough spaces to go around. A part-time nurse the other day said she was going to go home and...
Yeah. I'm a sort of job that's right up your alley, isn't it?
I'm sorry, but that's not in my...
Jurisdiction. Yeah, got it.
Allocating 2 more spaces should be enough to stop the staff grumbling. You wanted to do something to help Chris? So here's your big chance.
I thought your PA was supposed to be doing all that.
My PA is driving me nuts.
Talking your head off every 5 minutes.
I wish. She won't tell me anything. She won't let me in the loop. I don't know who's doing what or what's meant to be where.
She's just being loyal to Chris.
Yeah, and disrespectful to me. I'm not going to stand by and let my bloody PA tell me what I can and can't do. Which, if Libby has her way, is just about everything.
Which is a good thing. This job is a blessing in disguise. You get to work, but at a nice leisurely pace, which is what you need right now.
You think that rejigging car parks is what I need right now?
Staff parking, are you kidding? Craig, you're head of ED. You have your own designated car park. You have no idea what us lowly nurses go through.
So you drive round a couple more times?
If we get here at the crack of dawn, maybe. Otherwise, we have to pay through the nose to park nearby. Free parking is streets away. And at the end of a long day, walking miles back to your car is loads of fun, especially at night.
I had no idea that you cared so much about parking.
Everybody cares. It's huge. If you so much as even touch this, you'll be a hero with the nurses. And who knows, you might even impress Libby.
As you can see, the metastases are compressing his spinal cord.
What was his name again?
Gary Davis. He's 47 years old. He's already survived a partial lobectomy and made it through enough radiotherapy to kill a horse. And his blood work's good right now, so
he has end-stage cancer, Sarah.
He's in pain, but you won't hear him moan about it. All we can do is shoot him up with morphine. He's the most courageous patient I've ever met, and he's going to spend the last few months of his life totally gaga. He doesn't deserve that.
You know the usual treatment is...
More radiotherapy, yep, I know.
And you'll need to speak to his oncologist
Been there,
first.
done that. She can't offer him any more radiotherapy, and in the end she came to the same conclusion I did. Surgery is his best bet. Okay, so I'm a pushy cow.
You're also very good at emotional blackmail.
Well, I'm only good if it works.
Okay.
Thank you.
Okay, I'll see him, then make my decision.
That's all I ask.
Hey, these are Harry's.
You won't mind them being used for the greater good? Now, Napoleon, Spartacus, even Cortez, what did they all have in common?
Pass.
They were all great generals, and they all had a battle plan.
And did they all need to deface hospital property?
They're photocopies. Anyway, you should be smiling. I found the 2 extra car parks you needed.
Great.
In fact, I found more. In fact, I've decided to overhaul the entire car parking allocation system.
Craig, there is no need to do that.
Yes, there is. And I want you to put it on the agenda for today's meeting. This is a mess, and I'm going to fix it.
What's the difference between God and a doctor?
God doesn't think he's a doctor.
That's as good as it gets and you're not laughing?
Gary, this is Justine Jones. She's one of the surgeons here. We have just been discussing your CT scan.
Hi. The pain in your back has been caused by a secondary cancer. I wondered if we could discuss the possibility of surgery to remove those tumours and look at...
There he is.
Oh, sorry.
No, that's fine.
Where's Lachlan?
Oh, he's on his way.
Everyone, this is my partner, Nico.
Hi.
This one here wants to operate.
Possibly.
You can do something?
I might be able to ease the pain, that's all.
Is it a big op?
We'd remove a small portion of the affected bone, currently putting pressure on the nerve root. That's the cause of your back pain. I'd also like to consider doing some structural repair to your spine. You'll need another operation called a laminectomy. That's what will actually relieve the pain.
And the risks?
More nerve root damage, a fluid leak from the spine, or you could pick up an infection.
What if I pass?
You'll be referred back to Central and treated conservatively.
Which means I'll do nothing.
Which means that you'll need a permanent catheter and you'll be paralysed.
So how was your day, darling?
Okay, you've got a point. He's impressive.
So, do you think that surgery's a go?
Has anyone spoken to Brenda? Brenda?
Gary's an old friend of his.
Friends like that who needs end-stage cancer, right?
Cards on the table.
You trying to be funny?
No. I am trying to say I'm sorry. I know I overreacted to, you know what.
The innocent little poker game that doesn't hurt anyone. The little poker game that you introduced me to.
Things were starting to get on top of me and I took it out on my one and only friend.
Forgotten already.
Thanks.
Hi, where's the emergency department?
Oh, I'll be with you in a moment.
Lachlan, why didn't you tell me you were coming in?
I haven't come to see you.
Can I help?
No, it's fine.
This is my dad.
Your dad? What's he doing here?
He's in the emergency department.
Oh, I'll take you through.
I can do that.
No, it's no trouble. Come on.
Okay, item 6, budget forecasts.
Can we jump ahead to item number 7? I'm a bit worried about that one.
Me too, I love my car park.
Yes, what exactly is meant by reallocation?
Item 6, people.
Which is get your budget forecasts in on time. Do we all agree to do that?
We do.
Good. Item number 7. Off you go.
It's come to my attention that the nurses get a pretty raw deal when it comes to hospital parking, especially the afternoon staff. They end up parking miles away, they come to work late, and and then they have to walk back to their cars when it's dark.
They can get security to walk them to their cars.
Yeah, that's not working. Sometimes the nurses have to wait for ages.
Yeah, well, hands off the PCC car parks. Our present allocation is woefully inadequate.
Yeah, ditto for on-call staff, plus their spaces should be a hell of a lot closer than they are right now.
If we're talking priorities, I'd say surgeons should be getting first dibs.
Oh, what, are you saying that you're better than everybody else?
Okay, that's enough. Nothing's been decided yet. Now, any changes that are made will be thought through very carefully. Let's just leave it there for now, thanks.
Boy, you're an ED. We've been all over the place.
Sorry, I should have texted you.
Hey, don't worry. I'm not going anywhere just yet.
Brenda.
Hi.
Well, I'd have to say you're looking a lot better than I am.
What have you gone and done now, eh?
Just need a little op, that's all.
Oh?
No, don't.
Well, then tell me.
I've got lung cancer, Bren.
You should have told me you'd been admitted. I would have made sure my nurses were on the ball. 5-star service and all that.
That's okay, Bren. Your nurses have been fantastic.
Still, I would have liked to have known.
Yeah. Not nice finding out like this.
Yeah, well, never mind about me. Now, if there's any way I can help, anything I can do...
Excuse me.
Yes, Lockie.
I'd like to talk to my dad. In private.
Oh, of course.
I didn't mean you, Nico.
We'll catch up later, eh? Have a good natter.
Sure.
No problem.
Okay, we'll just send them down when you can. Cheers.
Oh, what are the people?
The headline news on Gary Davis.
Oh, yeah, he said he knew you. I was going to track you down, but he...
What operation is he having? I can't see it in the notes.
Well, can't you ask him that?
His son's with them at the moment. I don't want to interrupt.
So how do you guys know each other?
Old friends, that's all.
Right. You know, Gary's now Justine's patient, so it's probably best if we get the full story from her.
I know he's got lung cancer. I just don't know what stage he's at.
Well, like I said, maybe you should speak with Justine about that.
Look, Sarah, please.
Okay, all I can say is that the operation would be palliative.
Okay, so it's end stage.
Got it. Sorry.
If I was a patient, I'd want my friend taking care of me. Not that I'd want special treatment. Who am I kidding? Of course I'd want special treatment.
Oh, there he is, our hero.
What have I done?
We just want you to know it's nice to have a CEO who actually cares about the nurses. I have been complaining about the parking situation for so long, but no one's ever listened until now.
Fascinating how you guys know so much about confidential managerial matters.
Well, we should be in the loop. It's an important issue.
Look, I'll do what I can, but HODs have already started handing out the red tape.
What would the HODs know?
Yeah, exactly. They just cruise into their own designated park.
Tell them your story.
Oh, this is a set.
No, just listen.
It was dark. No one around. I'm walking to my car.
Shouty.
Craig, the guy came out of nowhere and he was carrying a tyre iron.
Oh, hell.
Okay, so he was changing a tyre, but he could...
Guys, come on.
But he could have been a nutter. You don't know.
Your concerns are duly noted.
So you'll burn through that red tape?
I'll try.
Like I said, our hero.
So, what exactly do you want to know?
When you're planning to operate on Gary Davis.
Who said I am?
I have no right to ask you for a favour. I need to know.
Speak to Gary.
It's, complicated.
This is a patient confidentiality issue, Brenda, and I'm playing it by the book. That's where you like things, isn't it?
If this is what payback looks like, from where I'm standing, it's not pretty.
Oh, please, I'm not that shallow. Gary Davis isn't your patient, simple as that. But he's obviously your friend, and as a friend, you're most welcome to talk to him yourself, scary as that may be.
Parking requests from radiology, orthopedics and Jacko, a cleaner who started last week. 2 spaces, that's all I asked for, just a little shuffle here and there, no one else needed to know. I'd hate to think what Chris is going to say. Right, now that everyone's expecting a miracle, what exactly do you intend to do?
Solve the problem.
How? You have no idea, do you? Right, I'll take it from here. This has gone far enough.
No, you won't.
Yes, I will.
Libby, give me the plans.
Make me.
Libby, define rank. Define chain of command. Define performance review.
Okay. But let me make one thing very clear. If you stuff this up, you're going down on your own.
You sure that's everything?
I didn't want you getting bored and chasing the nurses.
Hey, it's spoiling our fun. He's tired.
Oh, okay.
Maybe some other time.
Oh, wait. How long has he been ill?
7, 8 months. This operation, will they give him some more time? You know.
He's getting the best care possible.
What does that mean?
He's in exactly the right place.
You don't even know what's going on, do you?
Shortland.
Can you please tell your father to stop cracking jokes? He needs some rest. I'll try. Those guys are too funny. Camp as royalties, though. Are you okay?
No.
Oh, I'm sorry. Is he a friend of yours?
No. He's my husband. And that beautiful young boy in there is my son.